Welcome to some of the great features of Champion's most popular recliner models. In this video, we want to briefly show you how they work and how they benefit your patients and staff. The particular models covered in this video are wall huggers. That is, they can be positioned just 6 inches away from the wall and move through all positions without contacting the wall. This makes them great space savers. Casters should be locked prior to any patient entering or exiting the recliner. For optimum patient comfort and control, have the patient sit with the hip and back in firm contact with the back of the chair. To use the different recline positions, first make sure the patient's lower legs are against the leg rest to help control the operation. To recline, locate the actuator on either side of the chair. Pull up on the actuator to release the leg rest and have the patient allow the leg rest to raise until it is fully open. The fully open leg rest puts the recliner into the TV position. Once in the TV position, the patient can easily engage the infinite recline positions. To recline further, the patient simply leans back to move the chair to the most comfortable spot, applying pressure with the back, shoulders, and head. The patient can also pull on the arms to recline back. When moving back to different recline positions, the recliner and patient move forward and slightly up, keeping the patient's body mass centered over the chair's footprint for extraordinary stability. To return to the upright position, the patient simply sits up to the TV position and then pushes down on the leg rest until a click indicates the leg rest is secure. The patient can now exit the chair. For additional patient convenience, the fold-away side table can be used simply by raising the table and pushing up on the thumb tabs to secure the brackets. Champion tables are specifically designed with 2 locking hinges for stability and support. Some recliner models have swing-away arms for ease of patient transfer. To use this feature, release the latch at the bottom of the recliner arm and swing the arm open. Swing-away arms also facilitate a thorough cleaning for infection prevention. A removable seat makes it easier to keep the chair clean, also helping with infection prevention. To remove the seat, place the palm of your hand on the leg rest and release the recline actuator with the other hand. Fully recline the chair to expose the yellow thumb knobs on both sides of the chair under the outsides of the seat. You may have to remove the packing tape if this is the first time the seat has been removed. Remove the thumb knobs on both sides of the seat. Lift up on the backrest and then close the leg rest to bring the recliner back to the upright position. Gently lift up on the front of the seat and pull the seat toward you as you would to open a drawer. Slide the seat out until the quick release tab clears the flange at the top of the mechanism and then set the seat aside. Please note, if your recliner is equipped with heat or heat massage, there will be a wiring harness attached to the seat. In this case, the seat can be flipped up and placed in the chair, allowing for easy cleaning without unhooking the wiring harness. To return the seat, replace the seat frame on top of the flange at the top of the mechanism with a quick release under the flange and slide the seat onto the mechanism flange until the stud reaches the flange. Gently lift the seat up and drop it into the slot at the end of the flange and secure it with the thumb knobs. Securing the thumb knobs is easiest in the full recline position. Certain models make patient transport easier with the help of a push handle, special casters, and a foot tray. The foot tray provides a convenient step to help a patient into the chair and during transport. One note of caution, foot trays have a 225-pound weight limit and should always be stored when not in use. Recliner models equipped with the 4-inch, 5-inch, or 4-inch twin-wheel casters have a steering caster on the back for easy maneuverability, which can be locked to improve straight-ahead control. The Trendelenburg feature is an option for these recliners. This puts the patient in a flat body position with a 12-degree inverted recline to improve blood flow to core organs. It helps with patient comfort with reduced kink points. And with the Champion wall hugger mechanism, it provides greater stability. To operate, the patient must first be in the full recline position. If they are incapacitated, the caregiver must first release the actuator for the leg rest and put the patient in the TV position. With your hand near the top of the backrest, push down to put the recliner into the full recline position. Locate the Trendelenburg release at the back of the chair and lift and hold it while at the same time pushing down on top of the backrest as far as it'll go. This will put the patient in the Trendelenburg position. To disengage from this position, lift and hold the Trendelenburg lever as you raise the back of the chair to the TV position. From there, you can help the patient continue to an upright position. It is important to note that the Trendelenburg option is primarily used in emergency situations, and it is important to use it in the proper sequence of steps as we just described. If this process is done in the wrong way, the recliner may not perform as expected. Thank you for watching this informational video on Champion's classic Ascent and Ascent II recliner lines. With proper care, cleaning, and operation, your Champion recliner will provide you with many years of outstanding service.